Wonderful. Thank you so much, Jason, and to the CXPA and the CXPA Rochester community for facilitating this conversation today. You know, it's so funny because a year ago, when I would tell people that I work for an AI company, they would be like, "Oh, that is so cool. Like, tell me more about it." And I've noticed a shift over the past 6 months. And that shift is, you know, I tell people I work for an AI company and they're like, "Oh, that's scary." Like, oh, there's like this fear kind of and this uncertainty. And it's because there's a lot of hype right now about AI and talk about how AI can be leveraged for a more noble purpose, and that purpose really being to help humans understand humans. I'm getting an internet connection is unstable, so hopefully we can make it through. But I'm going to keep going. Okay, so when you think about you know, what are some of the things that we can do to understand humans better? Pop open the chat window and let me know what comes to mind for you when you think about answering this question. What can we do to understand humans? Jason says, listen. Listen and ask. Think from the perspective of others. Understand, be curious, observe. Watch what humans do, have empathy. I love those. And all of those are things that we can do to better understand humans. Michelle says, map their journeys and understand their friction points with empathy. One way, you've said it, that we can improve our understanding of humans is by listening to humans. And you've captured this as well, listening to humans in their natural states, observing them, not in research laboratories or through solicited requests for feedback, but really seeking to be the fly on the wall of their experiences. And the good thing about AI is giving us the capacity to be on the fly on the wall to our customers' experiences. It's creating the capacity for humans to be able to be with thousands of customers, listening, observing, and understanding them. And so for our time here today, let's refer to this kind of capacity as listening at scale and the opportunity that AI gives us to listen at scale. Now, before AI, if a leader came to us and asked us for insight into solving a business challenge, it might look like something like this. So let's say a particular segment of the business is losing customers. Customers are churning at a higher rate than other business units. This is a customer behavior problem. It's a customer understanding problem. And so we would seek to understand why humans are choosing to leave the business. And before AI, we might do something like we might reach out and talk with our customers, ask customers who have left, customers who have stayed, and engage them in conversations. We might talk to our employees to understand. We might launch a survey program or consult our existing survey program for insight into what are the drivers of dissatisfaction, what are the drivers of detractors in our business. We would crunch some analysis from that solicited feedback to understand what are we hearing, what are the themes in our customer data, what can we learn from this to answer the question of churn in our business. And then we prepare a presentation and facilitate action workshops. With AI, though, this process, it can look different. There's a lot of value in that process. That process isn't going away, but AI brings us a different opportunity to leverage existing data within our business that has historically been stored and ignored. And this data source are the conversations that our customers have when they interact with our business, when they meet with our sales team, when they call our contact center, when our sales rep types in notes that summarize sales interactions. Companies are starting to realize that this data source, unstructured data, is a gold mine of knowledge and insight into the human behaviors for the paying customer, who will always be a human. And they're looking at ways to leverage AI to listen to this at scale. And so here's how this process would look with AI. First, you start by creating training data that your machine learning models use to learn from. And I've got just a couple examples here. So here's a clip from a conversation that a customer had with a healthcare organization. And here we can see things like emotion, and we can see reason for the emotion. So we see frustration related to medical billing. In this example, we see an emotion of unnecessary stress from not receiving the return label. Here, we see worry about conflicting information for how and when to order medication. And in this example, we don't detect an emotion. The emotions were in the red kind of highlight, but we do see why they're calling. And in this example, they're calling because their prescription medication looks different than what they expected. And for a pharmaceutical manufacturer, this would be of concern. So with AI, what is happening is companies are starting to create machine learning models by tagging and labeling elements within a conversation that are important to them. That process of teaching the machine how to detect information within conversations is turning unstructured data. By the way, we speak 125 to 150 words a minute. So that's a lot of unstructured data. It's starting to take that unstructured data and turn it into structured data. And that is allowing us to aggregate the data to identify themes, outliers, trends, and understanding of a data source that is unsolicited and authentic data source of human behavior. When we combine this data of the aggregate data that comes out of machine learning model detection with micro customer stories, we can create insights that speak to both the head and the heart of our business. And when we do that, when we speak to both the head and the heart, it drives action. And at Authenticx, we call that data-backed storytelling, where we're combining the quantitative data that's coming out of AI with qualitative stories that bring that data to life for purposes of understanding. So as Jason mentioned, my name is Leslie Pagel, and I am delighted to be here today. I have found myself really wanting to help educate CX professionals, particularly about AI, and be a source of knowledge and understanding in a world where there's a lot of misunderstanding and lack of clarity. we're going to spend the next 30 minutes really peeling back the onion for that process I just showed you. But before we do that, I wanted to just share a couple things about myself to set the stage. First is I'm not a data scientist. I'm not a statistician. I'm not going to pretend to be one. I have spent my career over 25 years now in the world of customer experience, and specifically helping companies keep their finger on the pulse of customers so that they can create a competitive advantage in their business for on the customer experience. I have a passion of conscious business practices, and I feel very fortunate to be able to do the work that we do at Authenticx, which is using AI to listen at scale, and specifically within healthcare. We do work just with healthcare companies, that's providers, hospital systems, payers, some med device. And so you'll hear me use language of healthcare today. I'll try to create a bridge for other industries, but that's kind of the essence of my experience with AI. Last thing is we titled the session Generative AI, and I put a little strike through with generative because not all AI is generative AI. And one of the most important things is that we start with the problem that we're trying to solve, not with the form of AI that's all the hype and the rage these days. And generative AI has a lot of newsworthiness about it, but generative AI is not the only form of AI. So today we're going to talk kind of a bit broader about AI for helping humans understand humans. I've got three things that we're going to walk through today. The first is some context setting. This is just to kind of ground us in the application for using AI to listen at scale. The middle section here in yellow, I will be sharing with you 4 forms of AI that are being leveraged to listen at scale. Generative AI is one of those 4 forms. And then I really hope to kind of bring that middle section to life by sharing 3 different examples of how AI is being used to listen at scale so that you can kind of put the AI form into context for business purposes. So that's what we have covered, and I'm just going to dive in and get started. So for context setting, you know, when you think about human understanding, a core element of human experience is conversation. Virtually everything we do is through conversation. We become friends, we become spouses, some become exes, we become employees, we become customers through language. And you would think that given its significant contribution on human behavior, that we would have been studying conversations for as long as we've studied things like the human body or the stars in the universe or elements of the earth. But the reality is that's not the case. Did you know that the field of conversation analysis, it only started in 1960s, the late 1960s? Did you know that there are less than 1,000 conversation researchers in the world? Did you know that our failure to study conversation has resulted in us ignoring the authentic human experiences that our customers have with us? It's no wonder why trust is fading among consumers. Now, imagine if companies actually listened to every conversation occurring between their customers and their business. Imagine what we might be able to understand about human experience for both our customers and our employees. And the great thing is we don't have to imagine it anymore. We're doing it. Technology has made the process of studying natural occurring conversations easier today than ever before, because most conversations today are recorded. Jason started today's presentation by saying, this presentation's being recorded. Now, I wouldn't necessarily call this a conversation, but hopefully we'll have some conversation. Documented unstructured data, which is conversational data, it's unstructured. It is growing at a rate that is 3 times faster than structured data. And that is because we're starting to record and document our conversational data. So we record calls. Sometimes it's locked up in notes in our CRM systems or in our electronic health records, but we're creating more and more unstructured data through the use of technology. This is the data that we're going to talk about today. We're going to be talking about the unstructured data that largely for us in our world at Authenticx lives in contact centers and in electronic health records or in CRM as notes fields, as summaries of conversations. As CX professionals, the last thing I'll say is that, our charter is to remove friction from the journey and to create experiences that our customers value and appreciate. And when you think about where can we go in the business that is the source of friction in the customer journey, I can't think of another place that is more insightful than the contact center. And why? Well, it's because that is where your customers reach out to you when they have a question or when they get stuck and they need your help. So the contact center data alone is the place that is giving us an opportunity to learn more about the human experiences when customers have questions about our interactions with them. So that's a little bit of context setting for our time today. We're largely talking about unstructured data. Where does it exist? In your contact centers, it's locked up in your CRM systems, electronic health records. I'm going to talk through 3 forms of AI, and I'll be a little vulnerable here. I am very comfortable with all of these forms, but I found that communicating them, I need to work on how they're communicated. So you can give me feedback after this. The first, I'm hoping to bring that to life with the client examples too, I'll say. The first form is what we call rule-based classifiers. Now, think of this form as an interface that your CX team would interact with, and it would tell your conversational data what you're interested in looking at. So it's business logic, where an expert in the business is saying, this is what I want to look at. Now, AI is being used to find that, but it's also looking at the context for what you're searching for and things that surround that search. So this is very much human and AI working together to identify topics of interest, so that you can, 1, see the prevalence of that topic in your conversation data, see how that topic trends over time, dig down into it to see if there's any themes related to that topic. The visual that you're seeing here is an example of someone that's interested in looking at the topic of prescription refills. So they have told this system, I want to look at prescription refills, and these are the types of things that patients are likely to say when they're talking about prescription refills. And by the way, they don't always use the word prescription or refill. You know, they will say things like, I need to order my medication again, or I'm up on my medication. So it's having that kind of knowledge of conversational data and an interface where you're asking the machine to look for that. Jason, is there a question?
Yeah, I just had a personal question. Uh, and this is fascinating. What does the machine do, or the AI do, when it comes across a topic or theme it has not been trained on? And how does the machine deal with that or communicate it back to the system so that you can realize that, hey, there's a new anomaly, like we don't say refill, we say, you know, whatever that word is. How is that dealt with?
Yeah. So AI is only as good as the training data in which it is trained on. So in that example, Jason, it's about identifying areas that are not being picked up by the model and starting to inform the model about those particular areas.
Perfect. So it's not like ChatGPT where it can hallucinate if it doesn't have the information that
Oh,
it needs.
well, AI does hallucinate. It will hallucinate. And so that's another kind of important conversation surrounding AI is about the topic of explainability. And what that means is in your AI results that you're communicating, that you explain how you got that. And it's helpful to understand, one, how the AI picked up on that outcome of the data, and two, to help you tune and train your models over time as well.
Awesome.
Yeah.
Thanks so much.
This particular example, though, it's only learning from what the expert in the business is telling it to go do. But your question there, Jason, is the third form of AI, which we'll get to in a bit. So second is generative AI. People will talk about generative AI and also talk about large language models, LLM, in the same as kind of context. Generative AI, it is a machine learning approach. It learns from training data that it is fed. And it's a machine learning approach where the outcome is new and original content. So it is generating content. It's creating content as the outcome. There's, I think our limitation here is our imagination, because there's all kinds of things you can start to imagine that you could create from conversation data. Some of those are things like a summary of the conversation. I mentioned we speak 125 to 150 words a minute. The human capacity to listen to all of that is not existent, but we can skim through that using a summary of the conversation. Contact center agents also spend a lot of time summarizing the interaction after the call. So we're able to use AI to drive efficiency in their work and consistency across their work as well by generating conversation summaries. Another example is a lot of contact centers leverage AI to evaluate the agent in the call. Did the agent do a good job? Were they proactive? Did they take accountability? Did they listen? Were they empathetic? And it becomes an evaluation of the agent's performance. Well, generative AI can be used to generate coaching notes for the frontline staff. And you can start to see how someone who's really motivated might want to start to self-serve performance reviews. I can come in, I can see how I did on my interactions for this week, and I can get coaching notes that are specific to my interactions. Another example, more with quantitative data, is you can generate a smart summary. You know, we're talking a lot about listening at scale. Well, it's equally important to help our internal customers interpret at scale as well. And so generative AI is being leveraged to help our audience of our dashboards and our reports interpret the data that they're looking at. So that are some examples of generative AI. The third form is, Jason, the one that you spoke to, which is more machine learning models to detect at scale. This is where you are creating training data, and you're teaching the machine how to learn from that training data. The best way I think to talk about this is with Facebook. I don't know if you're on Facebook, but 8 years ago, when I would upload a picture to Facebook, I would have to tag myself and my family in it. And now I don't. Like, Facebook just knows when I put a picture up there that that's me. And it's because I've created training data. So Facebook detects me in pictures. And we are doing this with conversations today, where we are teaching our machine learning models how to detect things like friction. When a customer is stuck in their care journey, we call that the eddy effect. We're using machine learning models to detect sentiment. We're using machine learning models to detect if a patient had an adverse event to the medication that they took, HIPAA and other kind of elements as well. Last piece, or before I go there, Jason,
I was
question.
just curious because it's a topic that I seem to see more and more. The ability to measure sentiment and to make it actionable. Following customer experiences and knowing what the sentiment is at each touch point, and how a business could actually design those experiences so the sentiment is maybe positive versus negative. I was just curious if you have any comments or thoughts on like what AI is doing in the sentiment area and how businesses might be utilizing it from a standpoint of, customer design or measurement, as a KPI, a new KPI that businesses use to understand that, we're emotional creatures, right? So if we can understand the sentiment and the emotion behind the action or the inaction, then to me, it seems like we have, a superpower that we can activate.
Yeah, it's there are different methods for measuring sentiment. Our method is we're building machine learning models. So we've got a group of individuals. They're largely come from the healthcare industry that create our training data. So they listen to conversations and they say, by the way, we look at sentiment at the beginning of the conversation and at the end. So they'll say at the beginning, it's neutral, which is what it tends to be. And at the end, it ends more positive. We do all kinds of analysis of sentiment data. One that we haven't done that I would love to do is to show the relationship between ending sentiment and your post-call survey. Because I'm convinced that we can get rid of that post-call survey by just listening to those interactions. And I'm convinced that that ending sentiment is highly correlated to your post-call satisfaction metric or whatever it is. And being able to show that and all the additional context that you get from that conversation data, as opposed to your post-call survey, is added value to the business. So I love how you're thinking, Jason. I do see kind of ending sentiment being a CX metric of the future.
Yeah. Thanks so much for mentioning that.
Absolutely. Thanks for the question. Fourth and final kind of form of AI is what we call at Authenticx Smart Predict. And the way that I would describe this to a group of CX professionals is I'd have you think about your survey program and how one respondent to your survey can give you a lot of information. We ask them Net Promoter Score, we ask them their experience with our product, our people, our processes that we have in place. We capture demographic information. So one survey respondent gives us a lot of information. Well, that same thing is true in one conversation. In one conversation, we learn why they're calling, what emotions they have, where they are in their journey. How does the conversation end? Are there next steps? Do they have to go do something? Who goes off and does something? Are they stuck? The other side of it is when we listen to the agent, the customer service rep, we get to evaluate how well they did on that call. And so Smart Predict for us is thinking about all the things that we want to learn about from our conversation and using AI to automatically evaluate that conversation for us. And you'll see in the examples how that Smart Predict technology comes to life for a business here in example 3. So those are 4 forms of AI. Hopefully, I shared them with you in a way that is understandable. Would love feedback on that. Jason, what questions are there before I go to the next section?
Yes, I have a question from Jennifer asking about within pharmacy companies, which departments are leading this work? Is it the call centers or CX? I don't know exactly who you interact with if you're working with pharmacy, but that's the question.
Yeah, we work with a lot of pharmaceutical manufacturers, soon to be 8 of the top 10, and a lot of kind of smaller manufacturers as well. Generally, our relationship, kind of the owner of the relationship is in patient services, which is largely an operations function. We work also closely with a lot of compliance organizations as well, because there's risk expressed in conversational data as well. And then those individuals that we work with are realizing that their conversational data from the contact center, that the contact center is no longer a cost center, it's an insight center for the business. So they are starting to leverage their role in the business as contact center patient services, patient experience, to inform brand teams, to inform product, to inform executives and marketing. There's a lot of traffic kind of into contact centers through communications and language that we put out to the world. So it's being leveraged really as an enterprise source of insight, but largely owned by the contact center, patient services and compliance teams.
Okay.
Thanks for that question.
I do have another question that is starting to come in a little bit hot and furious here. Are there ethical concerns with listening and versus actively seeking feedback, and how can we address those concerns? So one person says that that's something that they're personally interested in but struggle with. So the ethical concerns about listening versus actively seeking feedback, I don't know, maybe through a conversation or a survey or whatever the case may be.
Yeah, it's a great question. I would tell you in our world, security and privacy is, it's the first thing we have to deal with. I mean, it is a part of doing business with healthcare companies, is that we protect the privacy of the individual. We didn't talk about that use of AI, but AI is used to redact things like names. We can take out any mention of a name in conversations, numbers, social security, phone number, member ID, strings of, identifying information. And we can also redact or not redact, but obfuscate the voice as well to protect the patient from that. So from a kind of security privacy part of ethics, there's a lot of focus on that as well. It's a great question. It's one that everyone should be asking in their business as well.
So just trying to anonymize the participant. Is it a process or protocol to let people know ahead of time, like when they start a call like we did today, this is being recorded, there's AI being used to interpret or summarize the conversation?
Yes,
Okay.
this call is being recorded for quality and
Yeah, assurance.
monitoring.
Yep.
Yeah, thank you.
Excellent. And I have one more question, then I'll let you continue. So do you have any examples of how you use all of this information that you learn to actually improve journeys? So like, how does this actually get into more of the journey mapping, the journey management, orchestration, things like that?
I love the question. I did not pull an example for the three, but I can tell you an example. I will start by saying that, you know, as businesses are, you know, we love our journey maps. But oftentimes those journey maps are created in workshops with various people. And the thing that I love personally about conversation data, it is the real lived journey that your customers are going through. And one of the things that is like nails on a chalkboard for me is when I see a journey map and like their contact center is its own journey stage. And it's like, that's not true at all. Like the contact center captures the customer's journey. So we have seen companies use their conversation data to create their journey maps and also use the conversation to identify where patients are getting stuck in their care journey. And I'll give you one example of that. We were working with a pharmaceutical manufacturer, and we showed their conversational data along the customer journey of diagnosis, getting kind of pre-screened before medication, getting the medication, and then staying on medication. That's just pretty generic. And what they found is that a lot of the conversations were at one journey stage. I'm going to say it was kind of getting started on the medication, but the area of friction was in the pre-diagnostics, the diagnostics that were required in order to get on the medication. So there weren't a lot of interactions at that stage, but when there was, it was a source of, we call it the Eddy effect, where someone is stuck in their journey. So it gives you insight into the lived experiences of your customers and also the data that you can see, okay, where are they reaching out to us? And in those moments, which ones are causing the most frustration? Which ones have higher sentiment, lower sentiment, that type of thing.
The sentiment is really like something that influences the journey because you can see you can hear the frustration, I should say. Awesome. All right, I won't interrupt you for a little bit. Thank you.
I'm gonna go. I've got 3 client examples here to share with you. I'll try to get through these in 8 minutes and leave 10 minutes for some more Q&A. The first is with a large Medicare health plan. They are very much focused, like every Medicare health plan, on their stars ratings because there is a lot of financial incentives that can be gained or lost in their stars ratings. And one of their hypotheses was that their prescription coverage, the Part D plan of Medicare coverage, was a source of member frustration amongst their membership. And so they asked the Authenticx platform to hone in on conversations related to prescription coverage. Now, granted, they did this in a time period towards the end of the year. And what they found is that members who are in the coverage gap, which is a federally mandated process, were experiencing higher degrees of frustration and confusion. And what they noticed when they looked at this frustration and confusion related to coverage gap conversations is that they noticed their agents, their front line, were helping to support the members in 3 different ways. The first way was not desired. And specifically, they would hear some of their member services agents say things like, oh, well, you're in the coverage gap. That's why you have to pay $3,000 for your medication. Or worse than that, you're in the donut hole. And when the agents would say this, you know, you might be able to imagine what a member would say, which would be something like, I don't understand what that means. What's the donut hole? What's the coverage gap? Particularly for members who have never experienced this before. They also found that there was another group of agents that in their help of supporting the member, they disassociated the coverage gap from their Medicare health plan. And they did that by saying most Medicare health plans have a limit on what the drug plan will cover for drugs. This limit is set by the federal government, not us, by the federal government. And it's the same for any Medicare plan you would choose. Now, granted, members still frustrated because there's a large cost for their prescription that they have to pay, but the agent is helping to manage the perception about the member, about their health plan, by helping to disassociate their plan from the member's frustration that they're experiencing. And then we heard a best practice, which is saying all the better things, but then taking that extra step to say, let's walk through what your out-of-pocket costs will be now and show you what is being covered by your plan. So this Medicare health plan was able to use their conversational data as insight into how they help their members manage their perceptions of them through a point in the experience that causes a lot of frustration. I'll also mention this plan did a lot of other things outside of just agent performance to help prepare members who are coming into the coverage gap, being more proactive. This example used that first example, rule-based classifiers, where the business created a rule. It said, I want to look at prescription calls, and this is what prescription calls sound like. And then we use machine learning to help listen at scale and detect things like frustration, where there's friction in the journey as well. Second example is with the hospital system. Hospital systems are very much focused on access to care, breaking down barriers that are keeping human beings from getting the care that they need. And they found in their conversation data that their patients were getting stuck, we call it the Eddy effect, in topics related to prescription refills. Specifically, they found that 43% of their prescription refill calls had patients that were stuck. Just to put that in context, across all the industries that we work with, we see about a 21% Eddy rate. So this is significantly higher than the norm. They used AI to understand what are the themes that are causing our patients to get stuck with refills. And they noticed things like There were delays because of shortages in the medication, or there are delays because the physician hadn't submitted the prescription yet. There were delays because the prescription was sent to the wrong location. Patients needed to have another appointment before they could get their refill. They noticed that their IVR wasn't working for prescription refills in the way that they designed it, but that's not how patients were using it. So they were able to fix their IVR. And they also found flat out human error in prescription refills. They shared these insights with the physicians within their hospital system. And this is the quote, this is a quote that we heard that I think we can all kind of resonate with. And that, you know, we're surrounded by a lot of data these days. And sometimes we forget that that data represents human beings. And so we were able to really bring a sense of humanity to the data by leveraging kind of the voice, the authentic voice of the customer. This example used rule-based classifiers to identify prescription refill. We used generative AI to summarize the interactions so that we can skim through and identify those 6 themes. And we used machine learning to detect where there was friction in the journey. Last example is a pediatric hospital. They were very much focused on understanding the agent performance, because the agent is a reflection of the experience that they're mostly caregivers calling on behalf of a child, so parents interacting with the pediatric hospital, and they wanted to understand how well they were doing. And so we have 8 different quality skills that we have AI built around to detect, that are an evaluation of the agent side of the conversation. And so this is an example of that smart predict, where I was telling to you, you can capture all of the things about a conversation. And in doing that, you can aggregate it together for purposes of scores for the business. And in this example, it's how well are the agents doing in supporting the caregivers who are calling into our hospital system. The last thing I'll say is really AI brings us it brings us an enormous opportunity to really understand humans. I've learned so much about conversations, and there's so much more to learn. And I really also see the opportunity that AI is bringing to us to reimagine customer experience measurement, where it's not just soliciting feedback and asking our customers to recall memories of their experiences, but really measuring the moments that our customers are interacting with our business. I am very active on LinkedIn, talking about AI, data-backed storytelling, conversations. Would love if you're interested to connect on LinkedIn. You've got my email address here as well. We put out a monthly newsletter called The Pulse, where we're sharing information about conversational AI and AI to listen at scale. If you're interested in subscribing to that, you've got a QR code here to do that.
Awesome. Leslie, this is fantastic. Thank you so much for taking the time to walk us through how humans can understand humans better. As you said in the beginning, it's amazing that we haven't studied this stuff, you know, since the beginning of time, because where communication is so important. So thanks so much. I do have a couple of comments here in the chat that I just want to bring forward. Let's start with this one. Some people are asking the difference between, let me just get back here. Okay, so some folks are seeing CX vendors like Qualtrics and Medallia offering the same sorts of things. They're interested in the difference between Authenticx and these other vendors. And just put a comma there for a second because there was another one that ties in. Is Authenticx just focused on healthcare, contact centers, and traditional telephoning channels, or are you involved in deploying ambient listening devices in patient rooms? So I don't know if maybe the difference between the other vendors can be an offline, or if you want to address that now, but also like, what are you doing in traditional telephony versus other areas where you could listen?
On the kind of comparison to Qualtrics and Medallia and others, I would say our approach of building machine learning models is different. I would encourage everyone, whether you're talking to Authenticx or talking to Medallia and Qualtrics, to be very curious about the approach that is used to create training data, the humans that are creating that training data, how that training data is validated. Our approach is different. One big way that it's different is we're just focused on healthcare. So our machine learning models are built from healthcare professionals who understand the nuance of healthcare, and it's using conversational data across healthcare as well. I love the question about the ambient listening, because that is one way that healthcare is looking to leverage AI to drive efficiency for doctors and like helping to take away some of that administrative activity. We today are not doing any analysis of ambient listening, but we're in the infancy right now. So there's all kinds of opportunities in the future.
I feel like that one can bump up against that ethical concern too. If you're in the doctor's room and you're interacting with your doctor, you definitely need to know what's going on there.
You do have to give consent. I will tell you on the value piece of it, conversation researchers have found that based on a conversation that a doctor's having with the patient, it can lead to unnecessary prescribing of medication. So it's an example of how kind of studying it can help us. But to your point, it's got to be under the right kind of ethical agreement.
And who knows, maybe it comes to a social norm, just like video cameras have, right? Like there's cameras everywhere. People are just used to being on camera. So maybe ambient listening will be the next generation of that. So there's also a question. So you kind of answered, you guys are focused on healthcare, but there's some folks maybe from the banking sector, other sectors. Do you find that this type of AI technology is launching in verticals, or are you finding companies that try to apply a blanket approach that goes across industries? So if somebody was looking for, a similar product in banking, for example, what type of advice could you give them?
I would tell you that the output of the AI is going to be more reliable once it's kind of industry specific and kind of the depth of insight as well. But there are things in conversations that are industry agnostic, sentiment being one of them. When we're stuck is another one, really. When we're stuck and we can't get forward, we're saying some of the same things in healthcare as in banking as well. So I would just, it really starts with the problem that you're trying to solve. And if it's an industry specific problem, you probably need an industry specific training data for it.
Great. And my last question before we wrap up, have you experienced pushback from call center reps feeling uncomfortable with AI listening or keeping tabs on them and, monitoring rep performance? So how does that work out with your clients?
I would say more of the pushback that I've observed is when customer experience takes this into operations, because operations like, oh, I don't want you kind of, overplaying oversight into, my playground over here. Call center agents, I've not sensed that there is pushback. There is some concern amongst quality assurance teams who monitor calls that their jobs are going away. And what we have seen is that their jobs are being elevated because instead of listening and monitoring calls all day for quality assurance, they're really able to understand what are some of the themes that we're seeing in this data that we need to solve for the business. On a positive, we are seeing frontline agents starting to adopt the language of the eddy effect, where they're in the moment, they're like, they're stuck in an eddy. And that's a good thing, you know, because they're starting to have language that they can apply that can help them understand, okay, these are the problems that we need to solve for our customers.
Excellent. Leslie, always a pleasure to have you on. Thank you so much for coming and joining us today. I encourage you all to reach out and connect with Leslie, maybe on LinkedIn or via email. I will send the recording of this presentation out to the network. Leslie, you had mentioned maybe slides. You want to include your slides? Okay, so I'll have the slides as well. And watch out for our next presentation next week with Lynn Hunsaker. Or not next week, next month, excuse me. And thanks everybody again for joining. Take care.
Thank you. Bye.
Bye now.